Hello, I'm Rosalie Michaels, and welcome to a special holiday edition of the Pain Channel. Alongside me today is Dr. Stephen Sywick, Medical Director of the Pain Center of Arizona, and over the next 2 weeks, Dr. Sywick and I will be counting down the top 10 Pain Channel moments of 2010.
Well, thanks for having me in the studio today, Rosalie. It's nice to talk to a person for once.
I know, right? Well, we're honored to have you here, Doctor. And it's been quite a year, right? It feels like just yesterday that the Pain Channel launched its very first episode.
Well, I remember setting forth some pretty ambitious goals on that first episode, and I think we've met a lot of them. Of course, none of these goals were more important to me than helping people in pain, trying to find some real solutions for managing their suffering. I'd say we found that one of the best ways to do that was taking our audience behind the curtain and showing them some of the details of some of the many procedures we offer at the Pain Center of Arizona.
Yep, which leads us to the number 10 Pain Channel moment of 2010. From that very first episode, a look at a real-life patient's spinal cord stimulation trial.
So a spinal cord stimulation patient is typically a patient, as I've said, that's got back pain moving into one or both of their legs, or neck pain moving into one or both of their arms. Typically, these patients have failed multiple medications. They've failed to improve with physical therapy. Sometimes they've been failed to improve with injections. Some of these patients have even had one or more surgeries. In those cases, the patients will often feel that there is no hope, there's nothing left. Well, that's just simply not true. Spinal cord stimulation therapy has changed many, many, many lives. You'll see today that Dr. Dowse will bring a patient back into the special procedure suite. The patient will be lying flat on their stomach. The typical preparation will happen. Dr. Dowse will be using this special x-ray machine called a C-arm, and it will allow him to see right down to the spinal level. From that, Dr. Dowse will insert into the spinal column a small little electrode and advance it along the dorsal column and produce some small, comfortable paresthesias. When we do that, it will allow the patient to feel this warm, comfortable tingling across the back and into one or both of the legs. Simply what happens is those paresthesias, or some of that comfortable tingling, will eradicate or take away, almost block out completely, that patient's pain. Once Dr. Dowse has found the appropriate level, he'll secure the electrode in. The electrode will be sticking out of the back for a few days and hooked up to a small little device that looks like about the size of a cell phone. The patient will be able to turn it on, turn it off, turn it up or down over the next 3, 4, 5 days for what we call the spinal cord stim trial.
Bye, guys. It was fabulous. See you
Thank you
later.
very much.
Thanks very much.
You know what, Dr. Sywick? I love how happy and energetic she is on her way out. It really puts a human face to the trial and helps convey that getting help for your pain isn't as scary or difficult as it may seem at the outset, right?
It really is. It's amazing the effect that those steps to managing your pain can have on a person. And we like to say that we're trying to get our patients back into life because chronic pain really can take a person's life over. One of the most rewarding aspects of my job and in creating the Pain Channel is seeing patients who are overwhelmed by their pain start to get back into their lives, to become active again, and to start having fun again.
Speaking of fun, I must say that one of my favorite running segments on the show has been the Pain Report. I'm always interested and often amused at the answers we get from people on the streets when we ask them about pain.
Well, I certainly have to agree, and I particularly enjoyed the answers that people gave in the migraine episode. There were some, let's say, interesting personalities in that one.
Yeah, that's one way to put it. So let's check out the Pain Channel's number 9 moment of 2010.
Do you suffer from migraine or headaches?
Yes, I do.
How often?
A lot.
Not normally.
Yes.
A little bit, not too often.
Every now and then, yeah.
How often would you say?
Probably like at least once or twice a month.
Headaches, yes. Migraines.
Never migraine.
Migraines, yeah. My family has a history of it.
A couple of times, yes.
I do. I get migraines. I used to get them a lot. Now I get them more infrequently because I think I'm managing them a little bit better than I used to.
Do you suffer from headaches or migraines?
Yes, like as right now I'm suffering from a big headache.
Big headache. So would you say that it's a migraine or just a really bad headache?
Just a really bad headache. I'm from Colombia. I don't know what migraine means.
I think the most impressive thing was the last guy's ability to function with a migraine.
I was impressed that he was willing to be interviewed.
Yeah, you know what? I think I might have to consider moving to Colombia now, where apparently it's a magical land where migraines don't exist.
I have to admit, while segments like that are a lot of fun, I really get excited when the show is able to get into the nuts and bolts of pain management and its operating procedures. I was particularly fond of the radio frequency ablation segment from episode number 2.
Now here's Dr. Matthew Doust performing a radio frequency ablation in the Pain Channel's number 8 moment of the year.
All right, so now we're seeing an actual procedure done at the Pain Center of Arizona by Dr. Doust, one of the pain consultants at the Pain Center of Arizona. Today's procedure, of course, is a radio frequency ablation procedure. And remembering that the facet joints can affect the neck, the mid-back, the low back. Those are joints that go from the top of the spine all the way down to the tailbone area. So today we're watching Dr. Doust in this procedure suite to prepare the patient. Dr. Doust is using X-ray guidance throughout this entire procedure, and what you can see is that allows him to really detail specifically these joints in the spine. What Dr. Doust is doing now is he's numbing up the skin in preparation for placing the active needles. What you see Dr. Doust doing now is taking the needles and, again, under live X-ray guidance, he's placing those needles right down to the level of where those specific nerves are that cause a significant amount of this arthritis pain. Now that Dr. Doust feels comfortable that the needles are in the appropriate place, as evidenced by the X-ray, he's using these cables that are hooked up to the radio frequency generator machine, and he places these small stylets right into the center of those specialized needles. Now Dr. Doust is asking the assistant to turn on the machine and to start to generate some of that heat. At this point, Dr. Doust has the needle probe inside those specialized needles, and the heating has begun. Notice that the patient is completely comfortable throughout this procedure and is really having no discomfort at all, despite the amount of the heat that's being generated through those specialized needles. And again, that's because there's a lot of numbing medicine that was placed in there. So again, this is a very simple and comfortable procedure. Now that Dr. Doust has done a radio frequency ablation treatment on each of those levels, he will now carefully remove the stylets and return those cables to his assistant. This patient has had an excellent, successful procedure, so now this patient will be taken to the recovery room, and we'll monitor them closely for the next 30 minutes to an hour. And as I said earlier, the patient might be a little bit sore for the next several days or so, sometimes up to a week. But the end goal here, it's about a return to a quality of life. It's about a better level of functioning. It's about getting our patients back to life.
It really is fascinating.
Absolutely. But what is uniquely rewarding is being able to follow up with the patient and the operating doctor and check in on the results of the procedure.
Procedure went great, so she didn't have any problems whatsoever. Hopefully she'll get as good a response in her cervical spine as she did in her lumbar spine. In terms of what to expect in the future, this isn't a permanent technique, so sometimes it does come back. On average, like I said, it lasts about 6 to 12 months, some people more, some people less. So she might expect in the future that we may have to repeat this somewhere down the line, but hopefully she'll get a long, pronounced pain relief, and we won't need to see her again. A lot of our patients too are able to get off of their medications and narcotics after doing this, which is always a benefit.
Now, not every patient we've come across this year has had an easy path to recovery. However, it's the stories of the people who have had to fight to get back into life who often provide the greatest inspiration, right?
I agree, and I was personally inspired, and I really mean blown away by Barbie Engel's story. Now, here's a woman who took an unbearable situation and managed to turn it into an opportunity to help others in need.
Check out the number 7 Pain Channel moment of the year.
You know, a lot of our patients that are watching don't know much about reflex sympathetic dystrophy, but there are many out there that have this debilitating disease. Tell us specifically about your journey. When were you diagnosed and what happened?
Well, in 2002, I was rear-ended in a minor accident. The guy was going about 10 miles an hour, and I instantly had pain and went to doctors and chiropractors, and they said that it was whiplash. And I started physical therapy and was getting worse, was complaining about this pain, but I didn't know the word to use was burning. And so doctors weren't really picking up what I was trying to say. So they sent me to a doctor here. I was actually at Washington State University. I was the head cheer and dance coach there. And the pain got so overwhelming that I couldn't coach anymore.
So a really active lifestyle before this accident.
Yeah, I was an athlete. I was well conditioned. I had a personal trainer that worked with me and my team. So when I couldn't get over the pain of this accident, I didn't know what else to do. So I just started searching and looking for doctors and trying to figure out what I could do to get out of pain.
Well, you know what's interesting is that patients that have reflex sympathetic dystrophy, some of them, it's after a significant trauma, a fracture of a bone, a surgery, but in many cases are even minor injuries, a minor sprain. So in your case, it was a whiplash injury from an accident.
Right.
So tell me now, a lot of patients that will often come to see me, what's a frustrating component is whether they've had maybe a more moderate injury or even a minor injury, there's not a lot of physicians that recognize this pain syndrome early enough. So how was that for you?
Well, I am an extreme case, but I saw over 40 doctors before I was diagnosed.
Oh, my word.
And I started having surgeries. I had a shoulder surgery, and one of the symptoms is swelling. And so I had a lot of thoracic outlet swelling in my thoracic outlet area. So they decided they needed to take out a rib. So they took out my rib, and there were some complications, and then I had 5 pneumothorax. One was a full lung collapse, and there was actually a bone going into my lung and a second bone hooked around my nerve bundle, so it was causing further damage. And as this was progressing, the symptoms were spreading all the way down my arm. So after my lung surgery, I had to go back in a few months later and have the rib repaired again.
Now, the unfortunate reality with RSD is that treatment for what is ultimately an incredible, painful, and debilitating condition often goes misdiagnosed or undertreated for years. Many physicians, and this certainly was true in Barbie's case, will try to convince the patient that the pain is all in their head. And yet, with all of this against her, Barbie still found a happy ending.
Well, after starting treatments in 2005, between then and 2007, I was doing radiofrequency ablations and going through a cycle of those, and I was doing better. I could function more. And in 2007, I decided that what happened to me shouldn't happen to anybody. No one should have to see 40 doctors to be diagnosed. And so I got together with my family and some other patients that I knew, and we started talking about what can we do to help. And we decided that we would put a foundation together and get the word out, spread awareness, and help other patients.
Now, to learn more about the Power of Pain Foundation or to make a holiday donation to Barbie's cause, visit www.powerofpain.org. Now, it's time for our final segment of the week, the number 6 Pain Channel moment of 2010.
Well, we started the show by highlighting a spinal cord stimulation trial, so it's fitting that we end it by coming full circle.
Dr. Jacob Amrani of the Deer Valley Spine Center performed a spinal cord stimulation surgery, and the Pain Channel was there to cover it. Check it out.
The patient is first brought to the preoperative area. The patient may be given some medications to help her relax. Then we take the patient back to the operating room. We then clean and prepare the skin on her back and above her hip with an antiseptic solution to prevent infection. Then we make the incision above the left hip, and we create a pocket in the fatty layer under the skin, and this will be for the battery. Then we make an incision over the spine in the midline, and we cut through the skin and the fatty tissue. Then we have to peel the muscle off of the bone. Then we have to remove a small portion of the bone in the back to expose the space between the bones. Now we are using a special instrument to remove the ligament between the bones, and this will open the space between the bones and give us access to the spinal canal. Now you can see us inserting the spinal cord stimulator into that opening, and we are sliding it into the spinal canal where it will sit above the spinal cord. Now you can see us passing a special instrument called a tunneler from the pocket for the battery to the incision in the midline, and you can see we are removing the central metal portion, and this leaves that long plastic tube under the skin. Now you can see us passing the wires through that tube, and that will lead the wires under the skin from the midline incision to the battery site. Now we're removing the plastic tube, and you can see that this leaves the wires under the skin. Now you can see us placing the wires into the battery, and the wires are being secured within the battery with a small torque wrench. Now we are creating a little loop of wire behind the battery, and we are placing the battery into the pocket. And now we are testing the system to make sure that the stimulator is making good contact inside the battery. Now we are inserting the battery and the wire into the pocket, and now we are closing both incisions.
Just amazing work. Unfortunately, that's all the time we have for this week. But if you enjoyed the show today, make a point to subscribe. And be sure to tune in next week at 3 p.m. when we reveal the top 5 Pain Channel moments of the year.
Well, it should be a great time.
And until then, I'm Rosalie Michaels for Dr. Steven Sywick, reminding you that as you see the closing credits, to remember, nobody's perfect.
See you next week, everybody.
Another new segment we're excited to blah.
Okay. 3, 2, go.
Hey, why did you want to become a doctor?
She was married 8 times to 7 different women.
I wanted to become a doctor because I like...
Look for Chef Rachel on healthycooking.com. No. It's hard to argue with him.
It's hard to agree
I
or
thought that was
disagree.
agree. I'm like, why would I not want to agree with the guy? Sorry. My bad.